Hi, I'm Hilary. I'm the Strategic Liaison Nurse for Learning Disabilities in Hertfordshire. And I work with the GP surgeries around getting really good quality annual health checks. And over the past couple of years, we've been really working hard to start looking at health as a really 365-day-a-year activity to try and reduce those health inequalities that people with learning disabilities face. People with learning disabilities die an average of 25 years younger than the rest of the population, and a lot of that is down to delayed diagnostics. So what we're seeing is annual health checks have to be a collaboration between the health professionals, the GP or nurse who does the annual health check, but also for the other 364 days a year, it's got to be really well supported by both the person with the learning disability themselves, enabling them to have as much understanding as possible about health indicators, and the people who support them. And that's what this is, just a couple of minutes to explain to you why you may be asked or you should complete the annual health check preparation tool. Now, we get a lot of feedback that it's too big, too much to fill in, too many words, and really we just want to get the message across that this is key to reducing those health inequalities. It is 16 pages, but actually it's only 3 pages of questions. The rest is giving you information and guidance and support on how to help someone understand things that they can look out for themselves or you can look out for as a person who supports them. So, for example, about because we always go for bodily functions, we've got in there about why people need to be mindful of what colour their wee is and how frequently they go. People end up in hospital with learning disabilities with urinary tract infections so frequently, and this is, down to dehydration and being mindful. So our health improvement nurses created this beautiful tool which is showing the different colours of wee. Now, we had a man last year who at his annual health check, the carers who support him had filled in this. They'd seen when it came to the urinary section that please download our chart, which is on our website. So they thought, oh, never thought about that. And the guy they supported was totally independent in the bathroom and would never tell them anything about what had happened in there, so they wouldn't know if he had constipation or a urine issue. So they thought, well, it's worth a try, so they put this up in his toilet. Now, within days, he came out and pulled them in by the hand. He's a non-verbal man, and he pointed to this darkest colour here. Long story short, he's now being treated for bladder cancer, caught early. He would never have had that caught by even the best annual health check. So those small things that we add into this tool are the things you can do to help someone have a greater awareness of their own health, or you to have that awareness. We guide you towards things like how to check your breasts for lumps and how to check your testicles, which are activities that every single month we should encourage people to do. It's boobs day or it's balls day, and whether it's a visual check or a physical check, no matter how tiny, just giving that person that awareness could be that difference of saying, don't forget in the shower, feel your boobs, it's boobs Monday. That sort of thing can be that difference between someone thinking, oh, I must, tell the carers something doesn't feel right. We've had someone turn up at their annual health check with a lump in their breast so large you could see it through the t-shirt. No one had spotted it. Now, if she'd been told once a month on a Monday, how's your boobs, she might have actually pulled someone and shown them that. So think about what you can do to be more aware and what the people you support can. And that's why it is so critical that this is done once a year. You are the annual health check for 364 days a year when the GP is there for 1 day a year. Once it's completed, keep it in your purple folder, make sure you get an annual health check action plan, and make sure you embrace all those tools we have on our website and really inject that support to help us reduce that delay in diagnostic, and let's improve that 25-year discrepancy in average age of death. Thank you for listening.